can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Kenyatta University Teaching Referral and Research Hospital is a modern tertiary health facility with state-of-the-art services that ensure delivery of cutting-edge healthcare and medical research in Kenya and the region. Located on a 100-acre piece of land in Nairobi County, Kenya, the Kenyatta University Teaching Referral and Research Hospital is a Level 6 hospital with a bed capacity of 650. It is easily accessible by public means, private vehicles, and has a helipad to enhance accessibility, especially in an emergency.
KUTRH is a highly specialized Level 6 referral hospital, and our flagship project is oncology, cancer care. But we also offer other highly specialized services, including cardiology, renal, and we also have specialized services in clinical care, ranging from orthopedics to surgery to all the other services within the clinical care.
Kenyatta University Teaching Referral and Research Hospital is a world-class healthcare facility, a concept largely attributed to Professor Olive Mugenda and financed through a government-to-government loan from China. The hospital was officially opened in September 2020 and has continued to make tremendous contribution in support of provision of specialized health services.
We are now almost 4 years old since we started, and we have about inpatient population of about 360 patients and many more patients who come every day as outpatient. We are a purely referral hospital, which means we don't accept walk-in patients. They must be referred by doctors from other hospitals, with an exception of accident and emergency where those patients, we are able to see them, of course, as they come.
Living up to its founder's vision, the facility has reduced the need for Kenyans to travel abroad for medical care, while also increasing medical tourism from other African countries in the region. It is overseen by a dedicated and experienced team of doctors who are supported by a professional cadre of nursing and paramedic staff. Kenyatta University Teaching Referral and Research Hospital is equipped with modern and sophisticated clinical and surgical equipment that provide comprehensive care for all aspects of health, from prevention to diagnosis, treatment and rehabilitation.
For us as a hospital, our vision is to stop medical tourism, especially the outward medical tourism, and we are deliberately looking at issues that take people away to other countries. We have dealt with the PET scan, and I can confidently say that the number of people who are going outside the country to get the PET scan treatment have reduced drastically. Now we have gotten CyberKnife, and as we get support from the government, we'll continue looking at the areas that make people go away.
Key services include accident and emergency services, diagnostic imaging services, surgery, pathology and lab medicine, physiotherapy and rehabilitative services, maternity services, specialized clinics, cath lab, oncology center including chemotherapy, radiotherapy and brachytherapy, renal unit, critical care services, wellness services, integrated molecular imaging services including PET, CT and SPECT, CT services and CyberKnife.
What we've done as government is that we have cascaded the issue of early testing to the county level. And that earlier testing from the county level will involve centers that we've developed. At the moment, we've developed around 4 cancer centers, regional centers, where we expect that patients would be able to be referred through the actual referral mechanism that we've come up with in the new thinking. And therefore, then they can be able to be diagnosed and be made, treated at that level. So this CyberKnife that is going to be launched on Monday by His Excellency the President is speaking to the thinking that we need and we have as government developed specialized treatment for non-communicable diseases.
Kenyatta University Teaching Referral and Research Hospital has a hospitality center providing quality accommodation spaces for patients and caregivers, especially those traveling from far distances within the country as well as those seeking services from other countries. The hospitality center also features a restaurant and a fully equipped gym. The hospital's flagship project is oncology. Because of the specialized nature of the treatment, the facility is purely of a referral nature, with patients being referred from other hospitals.
Cancer National Institute, that is the one that is helping us to put all stakeholders in place. Number one, to create awareness in terms of what cancer is and what Kenyans need to do to be able to manage cancer. National Cancer Institute, together with our program heads here, then they have gone ahead to derive and prepare policies, guidelines and directives on how then we go about diagnostic. So for us to be able to know who has cancer and at what level of cancer. The same institute, together with our program here, then they have developed mechanisms in terms of how do we treat. So we have chemotherapy, we have radiotherapy, surgery, and now this, the very high level that we are going to, that is being installed at, commissioned at the Kenyatta University Teaching and Referral Hospital. But also important for Kenyans to know that those who are registered on NHIF, they can access cancer treatment, including this CyberKnife that is being commissioned by Kenyatta University Teaching and Referral Hospital.
One of the cancer treatment services now available at Kenyatta University Teaching Referral and Research Hospital is CyberKnife treatment. This is a painless and non-invasive treatment for cancerous and non-cancerous tumors. The CyberKnife delivers precise pulses of high-dose radiation that target certain tumors and other abnormal tissues while limiting exposure to surrounding healthy tissues.
Contrary to what the name suggests, CyberKnife is actually not a knife, but rather an advanced radiotherapy machine that delivers very high doses of radiation with sub-millimeter accuracy.
With the CyberKnife, doctors are able to reach areas of the body that were previously thought untreatable, such as head and neck cancers and brain tumors, with a sub-millimeter accuracy. The precision of the treatment limits damage to healthy tissues, reducing side effects. Another benefit of this treatment method is the almost immediate recovery. These benefits make CyberKnife treatment ideal for patients who are unable to or prefer not to undergo conventional surgery.
We needed to get an equipment which can provide precision treatment, and that is why we started thinking, okay, we now can diagnose cancer at very early stages, but what do we do about those patients who need treatment? And we needed now to think of then, completing that continuum from diagnostics to treatment. And then we started looking for one machine which can, complement what we have, but very specialized so that people don't have to go outside the country to seek this particular service. Some of the conditions that can be treated using CyberKnife mainly is both cancerous tumors and non-cancerous tumors. This machine It's the second one in Africa after Egypt.
First, allow me to congratulate the leadership, starting with the chair of the board, Professor Olive Mugenda, together with the CEO, Dr. Dagane, for this milestone that they're achieving in terms of being able to commission CyberKnife. As you are well aware, that on the continuum of care of cancer, WHO has played CyberKnife as the best, actually the topmost, in terms of precision, in terms of dealing with the surgeries, dealing with cancer cases.
Kenyatta University Teaching Referral and Research Hospital is led by a board of directors as well as a management team responsible for the management and administration. The hospital's directorates are clinical services, nursing services, administration and corporate services, planning, development and partnerships, training, human resource development, integrated molecular imaging center, and research and innovations.
It's really good for us to have this sort of specialized machine here because it's first of all, it's non-invasive. It means that it is very safe and effective for treating cancers. And of course, we are excited for us to have this kind of treatment here because Kenyans, it means Kenyans now will no longer be going to India or other countries seeking those services.
Our vision remains to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens, with the mission to enhance quality of lives through provision of quality patient-centered and evidence-based healthcare training innovation and state-of-the-art technology. Kenyatta University Teaching Referral and Research Hospital services are carefully priced to ensure that they are affordable to Kenyans, while at the same time ensuring sustainable operationalization of the facility.
Stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. ICE. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ICE. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms. Thanks for watching. Help support St John Ambulance.
People may faint as a reaction to pain, exhaustion, hunger or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk/donate. When there's something wrong with your baby, if you know what to do, you'll give them the best chance of survival. If something has happened to your baby, you'll need to do a primary survey. This is a quick, orderly way for you to find out if your baby has any injuries or conditions that are life-threatening. You should always perform a primary survey before treating your baby because it will help you find out what's wrong and the best way to help them. We can use the initials DRABC or Dr. ABC to remind us of the steps we need to follow. These initials stand for danger, response, airway, breathing, and circulation. To perform a primary survey, first you need to ensure there's no danger. That means nothing near the baby that may cause further harm to them or to you. This is to avoid any injury to you and to prevent you from becoming a casualty as well. Look around quickly and make sure it's safe to approach. If you see any danger or anything hazardous nearby, clear it away quickly. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is not breathing normally, ask a helper to call 999 or 112 for emergency help. If you're on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you don't have a speakerphone, begin CPR for 1 minute before making the call yourself. If your baby is breathing normally, check to see if they are bleeding. This will enable you to stop blood loss from the circulation. Try to treat and control any severe bleeding. If your baby is not bleeding severely, place your baby in the recovery position. Just cradle the baby towards you in your arms with their head tilted downwards. This will help keep your baby's airway clear and prevent them from inhaling any vomit. Keep monitoring their breathing until help arrives. If they stop breathing, open their airway and start CPR. So remember, do a primary survey to try and find out what's wrong as quickly as possible. We do this by checking for danger, check for a response, open their airway and check their breathing. If they aren't breathing, call for help, ask a helper to dial 999 or 112 for emergency help and begin CPR. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. If they are breathing normally, check their circulation, check for severe bleeding and treat if necessary. If there is no severe bleeding, hold them in the recovery position until help arrives. If they stop breathing, open their airway and begin CPR. And that's how you perform primary survey on a baby. In young children,
Thanks for
seizure,
watching.
also known as a convulsion or
fit, can be caused by raised body temperature linked to throat, ear or other infections. It can occur because the brain is not mature enough to deal with the body's high temperature. When a child is having a seizure, you may find they have loss of or impaired response, vigorous shaking with clenched fists and an arched back, signs of a fever with hot, flushed skin and sweating, breath holding and red, puffy face, possible vomiting, or a loss of bowel or bladder control. If you think your child is having a seizure, place pillows or soft padding around the child so they don't injure themselves on surrounding objects. Do not restrain them. If they have a raised body temperature, try and cool the child by removing any bedding and clothing, although you may have to wait until the seizure stops to do this. Ensure there is fresh air, but make sure the child doesn't get too cold. When the seizure has stopped, open the airway and check their breathing. If they are breathing, put the child in the recovery position, call 999 or 112 for emergency help. While you wait for help, reassure the child and monitor their level of response. So remember, place padding around the child and don't restrain them. Try and cool them down. When the seizure has stopped,
open their airway and check their breathing. If they are breathing, put them in the recovery position and call 999 or 112 for emergency help. And that's how you help a child having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
The new Kenyatta University Teaching, Referral and Research Hospital is the boldest, most sophisticated health facility initiative ever undertaken in Kiambu County and Kenya. A project that has created a global health center that ensures Kenya and the region has world-class facilities that cut across the entire health arena to serve generations and contribute significantly to the Kenya Big Four agenda, specifically universal healthcare for all and the global sustainable development goals.
The President has made a commitment that this becomes a center for excellence, particularly for oncology in this country.
Kenyatta University Teaching, Referral and Research Hospital is a 650-bed capacity hospital with state-of-the-art medical equipment.
Kenyatta University Teaching, Referral and Research Hospital is a level 6 hospital. We will be offering specialized care. We will be expecting patients to be referred to us from other levels of care. So we'll expect patients from level 5 hospitals to be referred to us, those who require specialized attention.
The hospital is located on a 100-acre piece of land that lies in the northwestern part of Kenyatta University, bordering Kahawa Barracks to the south and the Northern Bypass Road to the east. The main entrance to the hospital is on the Northern Bypass Road near Kahawa West. It is easily accessible from main roads and public transport services. The hospital also has a helipad, a landing strip to enhance access. Following the preparatory phase of design and preparation jointly carried out by China Jiangxi Corporation and Kenyatta University, groundbreaking was undertaken in 2011 with the objective of providing a world-class healthcare in Kenya and the region. Kenyatta University Teaching, Referral and Research Hospital was the brainchild of Professor Olive Mugenda, who initiated the preparation of the proposal and leading her team from Kenyatta University in making a case for the hospital through the then Minister for Finance, who is now the current President, President Uhuru Kenyatta. The government approved a government-to-government loan from China Exim Bank for construction and equipping the hospital. The hospital was constructed and equipped at a cost of 8 billion Kenya shillings.
I'm happy that the vision we had 10 years ago has now been accomplished, and now we have patients accessing our services in this hospital.
It was the founder's vision to establish a world-class healthcare facility which will reduce to the barest minimum traveling out of Kenya for medical care abroad and at the same time attract medical tourism from other countries in Africa. Our vision is to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens. Our mission is to enhance quality of lives through provision of quality, patient-centered and evidence-based healthcare, training, innovation and state-of-the-art technology. Built and benchmarked with international standards to provide world-class healthcare. It is headed by a team of dedicated, experienced and qualified doctors supported by a professional cadre of trained nurses and paramedic staff. KUTRRH houses advanced and sophisticated clinical and surgical facilities, providing comprehensive care to address all aspects of health, from prevention to diagnostic and treatment to rehabilitation.
Even though we have many specialized areas in this hospital, our flagship project is a cancer, or what we are calling oncology center. And this center has 74 beds, and already we have started admitting patients. But I must also add that it's going to be a purely referral hospital. So our patients are being referred from other hospitals because of the specialized nature of the treatment.
Deliberately and carefully built in the fabric of KUTRRH is quality. The KUTRRH Board of Directors is responsible for the management and administration of the hospital.
I would like to thank the board members who are behind here, who have been working very hard, hiring the right staff here. As the CS said, we have the doctors, we have the nurses, we have other staff members who will be working with us.
The major directorates of the hospital are clinical services, nursing services, corporate services and administration, finance strategy and planning, training, research and innovations. The highly sophisticated medical center shall offer quality medical care with the following units: ICU, HDU. KUTRRH has the highest ICU and HDU bed capacity among the healthcare establishments in Kenya. There are 24 ICU beds and 10 HDU.
The beds are fully equipped with world-class bedsides where there is panels of sockets where we use to ventilate the patients. It has world-class machines for infusion of medications and drugs. They should expect quality health care, and we are ready to provide that care. We have qualified nurses and doctors on board, and all the nurses here are critical care nurses.
The burden of cancer is rising within our nation, and therefore KU is well placed in handling all matters regarding cancer. We'll be dealing with initially diagnosis and treatment of cancer. Treatment will involve having a radiotherapy machine, which is the most modern, called the linear accelerator, and we'll also be giving chemotherapy for patients who have cancer.
Every unit is equipped to treat every type of procedure, including trauma surgeries. Medicare is further supported by the availability of telemedicine to enable doctors to consult with peers worldwide on real time, thus reducing the need to seek treatment abroad. The ultra-modern laboratories are equally proficient to delivering high standards of services.
And we have the best equipment that you can find in any part of the world, like Europe and USA. And that means that you are able to diagnose the most complicated diseases without sending samples outside the country. And it also means that we are able to give the best teaching and practical approach as far as the students are concerned.
The hospital strives to extend world-class preventive, curative and holistic care to individuals from every level in the society in a safe, ethical and affordable manner with world-class infrastructure facilities that include outpatients, accident and emergency, pharmacy and diagnostic imaging.
The drugs we have are of good quality. We source them from Kenya Medical Supplies Agency, that's KEMSA. We have all sorts of drugs. Our core focus is drugs for cancer. We have drugs for dialysis, that is when you want to clean the system when a patient has renal failure. We have drugs for accident and emergency. Those are patients who present to the casualty with more or less emergency kind of conditions. We also have drugs for theaters, where those are used for in the event a patient goes under general anesthesia, so that the surgeons can perform what they need to perform, basically the operations.
Inpatient services, pathology and lab medicine, based and specialized, critical care, medical and surgical, specialized internal medicine, that is oncology, renal and neurology, diagnostic imaging, obstetrics and gynecology services. Kenyatta University Teaching, Referral and Research Hospital believes healing begins as soon as you arrive at the hospital. At the core of our new design, the idea of personalizing and humanizing the healthcare experience will be apparent at the hospital. Furthermore, the hospital premises provides a green, relaxed and soothing environment for healing and visits. Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare.
Privileged to have met one of the best doctors, in terms of matters oncology, matters nephrology, trauma management. We have them here.
The numerous conference halls, equipped with teleconferencing facilities, will enhance continuous medical education. It is expected that the hospital will provide the necessary environment and incentives for the conduct of biomedical research and clinical trials in order for our medical scientists to contribute to improved medical care and production of new pharmaceuticals.
Our hospital has three main pillars. The first one is on services, where we would be expecting patients to be referred to us. The second one is on training, teaching. So in the near future, we'll expect to start undergraduate and postgraduate programs together with other trainings so that we can build on the numbers of trained human resource in health. This will go a long way in us achieving the universal health coverage. Our other mandate is on research, and we have already set foundations, very strong foundations, where we'll be able to do a lot of basic research, applied research, and also conduct clinical trials.
The support services which complement medical care in the hospital are Doctors Plaza, staff quarters, academic block, laundry and catering services, restaurants, helipad, banks, among others.
If you look at the infrastructure around this hospital, and you look at the keen interest that the government has, if you look at the keen interest that our Cabinet Secretary of Health has in this hospital, and if you look at the need in the market, in the region, and even in the locality for this hospital, it's very, very clear that if we get our act right, this is going to be a hospital that is a game changer in the region.
The new Kenyatta Hospital Funeral Home is opened to the public.
We are also thinking of acquiring the first integrated molecular imaging center, and this is a center which will help minimize the number of people who seek cancer treatment and diagnosis outside the country, because the center will have the modern machines that are required to do that. So I must thank the government through the Ministry of Health because they are very committed to ensuring that the resources are available to start this center. And it will be the first center, public center in East and Central Africa. And it will really go a long way in helping Kenyans access the necessary treatment.
Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality health care.
I wish to inform you that Kenyatta University Teaching, Referral and Research Hospital is now open.
objective of providing a world-class healthcare in Kenya and the region. Kenyatta University Teaching, Referral and Research Hospital was the brainchild of Professor Olive Mugenda, who initiated the preparation of the proposal and leading her team from Kenyatta University in making a case for the hospital through the Minister for Finance, who is now the current President, President Uhuru Kenyatta. The government approved a government-to-government loan from China Exim Bank for construction and equipping of the hospital. The hospital was constructed and equipped at a cost of 8 billion Kenya shillings.
I'm very delighted to see a vision that we started 10 years ago being actualized and saving lives, particularly at this time of COVID-19 pandemic.
It was the founder's vision to establish a world-class healthcare facility which will reduce to the barest minimum traveling out of Kenya for medical care abroad and at the same time attract medical tourism from other countries in Africa. Our vision is to be a premier national referral hospital renowned for clinical excellence, medical training and research that enhances quality of lives for Kenyans and the regional citizens. Our mission is to enhance quality of lives through provision of quality, patient-centered and evidence-based healthcare, training, innovation and state-of-the-art technology. Built and benchmarked with international standards to provide world-class healthcare. It is headed by a team of dedicated, experienced and qualified doctors supported by a professional cadre of trained nurses and paramedic staff. KUTRRH houses advanced and sophisticated clinical and surgical facilities, providing comprehensive care to address all aspects of health, from prevention to diagnostic and treatment to rehabilitation. Deliberately and carefully built in the fabric of KUTRRH is quality. The KUTRRH Board of Directors is responsible for the management and administration of the hospital. The major directorates of the hospital are Clinical Services, Nursing Services, Corporate Services and Administration, Finance Strategy and Planning, Training, Research and Innovations. At KUTRRH, we believe quality is never an accident but a premeditated effort. The hospital is among few in the region to function with full-time doctors system that assures doctors' availability around the clock, giving dedicated time and attention to patients.
We mainly deal with offering clinical services and ensuring that all patients are treated accordingly. My division is very wide and it encompasses a lot of various disciplines, majorly of which is oncology services, accident and emergency, trauma and orthopedics, where we are able to perform surgeries. We have a fully established pharmacy which is able to provide nearly all kinds of drugs. In terms of laboratory, the whole pathology area, we have a well-equipped laboratory. We are able to do state-of-the-art tests.
The highly sophisticated medical center shall offer quality medical care within the following units: outpatients, accidents and emergency, pharmacy and diagnostic imaging, inpatient services, pathology and lab medicine, critical care, medical and surgical, special internal medicine, oncology, renal and neurology, obstetrics and gynecological services.
As a hospital, and more specifically as a pharmacy department, we pride ourselves with offering high quality services because, as I mentioned, our staff are very highly qualified. Then number two, our drugs are of assured quality because of the kind of sourcing that we go through just to bring them to the hospital.
Critical care, medical and surgical. ICU HDU, KUTRRH has the highest ICU and HDU bed capacity among healthcare establishments in Kenya. There are 54 ICU beds and 10 HDU.
The beds are fully equipped with world-class bedsides, where there is panels of sockets where we use to ventilate the patients. It has world-class machines for infusion of medications and drugs.
The Department of Anesthesia and Critical Care, we provide services in all these departments, especially theatre and the intensive care unit.
Oncology Cancer Unit. The ultra-modern oncology unit is a beacon of hope, health and happiness.
Our flagship project is Oncology Center, where we are dealing with cases of cancer. And we are undertaking very good services in radiotherapy and also radiology treatment with great outcomes.
The team of oncology specialists work together to develop individualized treatment plan for every patient with great results.
This team consists of the oncologists, the surgeons, the palliative nurses, our nutritionists, physiotherapy, the pathologist, and our oncology nurses. And once a week we have this meeting, the multidisciplinary team meeting, where we discuss the management of all the patients who were seen in the previous week, so that we can make the treatment of every patient a focused and patient-centered treatment to target the specific needs of every patient.
We offer cancer care services across surgical, radiation, and medical oncology. Every unit is equipped to treat every type of procedure, including trauma and surgeries. The ultra-modern laboratories are equally proficient to delivering high standards of services.
And we have the best equipment that you can find in any part of the world, like Europe and USA. And that means that you are able to diagnose the most complicated diseases without sending samples outside the country. And it also means that we are able to give the best teaching and practical approach as far as the students are concerned.
The numerous conference halls equipped with teleconferencing facilities will enhance continuous medical education. Embracing new technologies to offer high-level healthcare that matches the best globally. Medicare is further supported by the availability of telemedicine to enable doctors consult with peers worldwide on real time, thus reducing the need to seek treatment abroad. It is expected that the hospital will provide the necessary environment and incentives for the conduct of biomedical research and clinical trials in order for our medical scientists to contribute to improved medical care and production of new pharmaceuticals. Kenyatta University Teaching, Referral and Research Hospital believes healing begins as soon as you arrive at the hospital. At the core of our new design, the idea of personalizing and humanizing the healthcare experience will be apparent at the hospital. Furthermore, the hospital premises provides a green, relaxed and soothing environment for healing and visits. Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare. KUTRRH is one of the main COVID-19 centers in Kenya, being used for the isolation and treatment of COVID-19 patients. However, we also offer medical services in oncology, renal, pediatrics, and other specialties. KUTRRH recognizes the need for collaborations and partnerships. This internationalization programs gives our doctors, staff, and patients the opportunity to interact with doctors and specialists from other parts of the world.
We're building strong partnerships, for example, the University of Manchester and the Christie Foundation in the UK. We also received 20 Cuban doctors that are helping us fight the pandemic. After that, they'll be deployed in the counties.
The new Kenyatta Memorial Funeral Home is open to the public. The support services which complement medical care in the hospital are Doctors Plaza, staff quarters, academic block, laundry and catering services, restaurants, helipad, banks, among others.
If you look at the infrastructure around this hospital and you look at the keen interest that the government has, if you look at the keen interest that our Cabinet Secretary of Health has in this hospital, and if you look at the need in the market, in the region, and even in the locality for this hospital, it's very, very clear that if we get our act right, this is going to be a hospital that is a game changer in the region.
Kenyatta University Teaching, Referral and Research Hospital has continued to embark on projects aimed at providing quality healthcare. The ongoing projects include the construction of furnished hostels and apartments that shall provide accommodation within the hospital premises to patients and their families while undergoing prolonged treatment. An important ongoing project is the construction of the Integrated Molecular Imaging Center, IMIC.
We also today had the pleasure of laying the foundation stone for the soon-to-be Integrated Molecular Imaging Center. The hospital is beginning construction. The center will host a cyclotron machine, a PET and CT scanners. We have also laid the foundation stone for this hospital's hospitality center, which will cater for the accommodation and hospitality needs of patients and their families. The impressive equipment, infrastructure, broad services, service range and highly trained staff. Indeed, I foresee the Kenyatta University Training, Teaching, Referral and Research Hospital becoming a leader not just in this country, but in our region and also in the continent.
This iconic comprehensive cancer center shall provide medical relief to Kenyans and beyond.
This center will be the first public center in East and Central Africa, and will go a long way in helping Kenyans access the necessary treatment without having to go to other countries like India and South Africa. I would like to thank the President and the Minister of Health for their support and their interest in ensuring that this hospital becomes a center of excellence in Kenya and the region.
Given the advanced facilities the hospital presently has, combined with the human resources being assembled to undertake medical care, research and training, we hope to meet the expectations of Kenyans in the provision of quality healthcare.
Muhimu sasa na ya furaha ni kudeclare hospitali hii ambaye ndiyo Kenyatta University Teaching, Referral and Research Hospital officially open on this 10th day of September 2020.
Babies have lots of fun at bath time, but with any amount of water there's always a risk of drowning. As your baby crawls or toddles around, they may end up other places where there is water, such as swimming pools or lakes. If you think your baby is drowned, before starting CPR, move them away from the water and lie them on their backs, ideally on a raised surface such as a table. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath. Put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. If your baby starts to breathe normally again, then we need to put them into the recovery position. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs, covering both the nose and mouth. Then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you give CPR to a baby that has drowned. Thanks for watching. Help support St John Ambulance